things actually change. Because it is then that the levels of estrogen are associated to breast cancer. Because before menopause, estrogens are always high. After menopause, they are higher. They're associated to a higher risk of breast cancer altogether. However, if you put androgens and estrogens in the same model, you will the effect of estrogens is rather reduced, and you have the effect of androgens. So as Dr. Secreto was saying earlier on regarding the definition or the determination of the size of the tumor, there's an effect of both one and the other. Although androgens play a greater role, as Dr. Secreto said, the story of the androgens is very long. Certain dates really impress me. The fundamental date is 1964, when Professor Cantarola published his first study, which then gave origin to the hypothesis and the reasoning of this androgenic hypothesis. Well, 20 years later, Dr. Secreto published a study on cases and controls in which it showed that the concentration of testosterone in the breast cancer in the premenopausal phase, and he proved that the number was higher in the premenopausal years, in fact. And it was there that we decided to carry out a prospective study to see whether testosterone is higher even before these women become diseased. We started with the York study in the province of Varese. We still follow up 11,000 women, but it's taken several years for us to have enough number of cases of breast cancer in women before the menopause. The publication in 2004, that is to say 20 years later, we showed that women with high levels of testosterone in their bloodstream have a higher incidence of breast cancer. Giorgio, I believe that in 2024, doctors will start to believe that it might be useful to systematically measure the testosterone in patients with breast cancer, and perhaps even in healthy women, so as to assess their level of risk. The level of testosterone is also an indicator of prognosis. This is an analysis that we carried out on the control arm of Professor Veronesi. These were women operated on for breast cancer, not treated with chemotherapy nor with hormone therapy 25 years ago. This is a follow-up after 15 years, and we still had assays of serum that had been collected back then and had been preserved in refrigerators. Testosterone was tested in Dr. Secreto's laboratory on these blood assays, and survival without events is significantly higher in women that had testosterone below the medial value. This is a prognostic indicator of the same level of importance as receptors, lymphnodal metastases, and so on. On the basis of this knowledge, women with high insulin levels get sick more frequently, and so on. In the mid-90s, we designed the Diana study, Diet and Androgens. We studied with 104 ladies who had a very high testosterone level. We randomized them into two groups, and we tried to change the diet of these women, giving them something to eat in line with what was offered you during your buffet today. After 5 months, there was an important change in the concentration of a whole series of factors that we were able to measure. There was a very high rise in the SHGB, testosterone, free estradiol. There was a drop in insulin, but also in the insulinic area, and after a glycemic stimulus, the C-peptide went down, which is the indication of insulinic synthesis. We were not able to change the level of IGF-1, but we were able to push up the level of two of the binding proteins of IGF-1, which depend on the control of insulin. Last year, we published the first study which took into consideration the metabolic syndrome as a risk factor in breast cancer. These are the 11,000 women of the province of Varese, the subgroup of the menopausal women. And you see the women with the metabolic syndrome have 2 to 3 times as much risk as women who do not have any of the factors, but even those who have 2 factors. The metabolic syndrome is associated also to the prognosis. Women with the metabolic syndrome have a worse prognosis. This study, Diana, to 110 patients, show us that you can see here in the dark blue bars that if they have both the metabolic syndrome and a high testosterone level, but if you can have a situation with a metabolic syndrome but low testosterone level, if you have both of these factors, the risk of recurrence is very high. In the audit project, 11,000 women were checked. So if they had both the metabolic syndrome and testosterone, high testosterone, they have 3 times as much risk as the other women. So you can see in the light blue the women who do not have these factors.